Hey everyone, welcome to The Mental Playbook with Christine Dalgety. We're here to chat about all things mental health, share some awesome stories, educate, and advocate to break stigmas and gain power through knowledge for all ages and walks of life, and give you the tools you need to boost your mental game. So grab a coffee, get comfy, tune in, get inspired, and let's dive into some fascinating conversations. Remember, your mind is super powerful, and with the right tools and knowledge, you can master your mental playbook. And while you're doing that, take care of you. Hello, everyone. Welcome to The Mental Playbook with Christine Dalgety. Today's episode is about ADHD and women, females, and how it presents in females and how that differs. ADHD is just as prevalent in girls as it is in boys, but it goes undiagnosed in girls. When most people hear about ADHD, attention deficit hyperactivity disorder, we immediately think of little boys jumping around, blurting out, can't sit still, having difficulty in classroom settings, those types of things. We don't think about those very smart, daydreamy, distracted little girls, or the 40-year-old women who are trying to manage a family, manage time, hide those volatile emotions that are bubbling at the surface. While all of these presentations are accurate, female ADHD goes undiagnosed, sometimes for decades. And so many little girls slip through the cracks. And since COVID, especially, we have had so many females approach us looking for answers, information, perhaps assessments for ADHD, more than we've ever had. And, so many of these women, a lot of them are in their mid-30s, early 40s, and they say that, I've gone for assessments, I don't meet the criteria, they look at my childhood, and because my report card says that I didn't have behavior issues or I had good marks, they say that, no, I can't have ADHD. And so many of these women, when I tell my story to them about my previous job in education, I've been working with people with ADHD now for about 31 years. So I have a lot of experience in it. And my previous career was working predominantly, it was a behavioral therapist and counselor. And so it was predominantly ADHD, autism, behavioral issues, neurodivergent, students with neurodivergencies. And I would see it. I would see the little boys jumping around, impulsive, knocking stuff off desks, blurting out, and the little girls just daydreaming, looking out the window or looking right at the teacher and totally blank. And then they go up to the teacher when the teacher says, okay, let's go, let's get this done. And they go up to the teacher, I'm not sure what I'm supposed to do. And the teacher will often say, I just went over it. Go back to your seat and get it done. And then I could see panic on these little girls. And, then those little girls become teenagers and then they become women and they've been undiagnosed for a couple of decades. And then they come to me saying, okay, I'm finally figuring it out. And they're undiagnosed because of all the stuff I'm going to talk about today. What I'd like to also share, and I'll share it a little bit more later, is that these women that have come to us and we have helped them through some things and we have done some assessments and we've told them how to advocate for themselves. When they were put on medication, their lives have completely changed. So I think that, this topic today is very near and dear to my heart. I think that it is something that we really have to push and advocate for. And I do plan on having, follow-up podcasts on this and perhaps have some guests on it that have experienced it. And yeah, I just think that it is so important. And so many females slip through the cracks. And, when I explain everything today to you and how hormonal changes can affect it and ADHD can cause different disorders, related to hormones and, how our assessments are still old assessments that we use, education in it, all of that, I think that more and more people are going to see how much change we need. And, I said in my first podcast, if we can help just one. So, obviously our goal is to help many, but if we can help just one, advocate for themselves, learn, educate themselves. That's why I'm doing this stuff. So again, I like to start off with some statistics. And when I was doing some research on ADHD in females and ADHD in general, there was a survey, a report from Stats Canada from 2017. And they gave some conservative numbers because of the underdiagnosis. Of the diagnosed, so conservative numbers, 1.5 million people had a diagnosis of ADHD in Canada. And that was in the 2017 survey. And I also found a study, 2019, by the European Child and Adolescent Psychiatry Journal. And they share that females are less likely to be prescribed medication and receive a diagnosis because they don't typically display the same behaviors that boys do. And that is what we think ADHD looks like. It is so much more. Females do not display the external symptoms. And due to a lack of education on ADHD and how it presents in females, they're more likely to be improperly diagnosed with bipolar, personality disorders, anxiety, and depression. So let's understand ADHD a little bit first. In general, ADHD, attention deficit hyperactivity disorder, is a neurodevelopmental condition, and it affects both children and adults, and it impacts focus, attention, concentration, activity levels that make everyday tasks, interactions, everything more challenging. It's not just about being distracted. The number of times I hear, oh, I just got distracted, my ADHD's on overload, right? Or, oh, I can't concentrate, my ADHD. Well, it's the ADHD. No, it's a lot more than that. And I think that when we're using it like that, and I've been guilty of it too, although I'm pretty sure I do have ADHD, I think that, when we joke about it like that, it takes the prevalence away as well. It minimizes it. So it's not just about distraction. It is a complex condition that affects daily tasks, relationships, careers, school, everything. It's closely related to executive functioning because ADHD affects the brain's ability to plan, to organize, and to regulate behavior and emotions, and just regular behavioral tasks. Its executive functioning is a cognitive process that manages all of those things that I just said. So there's 5 ways that it does impact executive functioning. And again, this isn't just in females, this is both males and females. It impacts your working memory. So there's working memory challenges. So it's difficult to hold and use the information for problem solving. And it's people that with ADHD might forget the instructions. I've worked with children that, when things are written on the board, whether it's a whiteboard, blackboard, whatever it happens to be, they will read it on the board and they will forget it by the time they look down to write. So you forget the instructions, you lose track of things all the time, or tasks. You lose track while you're doing performing tasks in the middle of it. You may lose your train of thought and forget what you were saying mid-sentence. Time management struggles. So with ADHD, it's very difficult to estimate how long tasks will take. Time in general, it's really difficult to estimate that. And procrastination and difficulty meeting deadlines is huge with that. Emotional regulation difficulties. Intense emotional reactions and impulsivity is a symptom of that. And people struggle with frustration tolerance. So if they get frustrated, sometimes it often escalates because of what's going on in your brain and inability to regulate those emotions. Task initiation and organization issues. Often people, if something is going to be boring, if it's going to be strenuous, if there's a lot to it, there's a lot of procrastination. So just getting to it, just initiating that task. Sometimes it's something as simple as loading the dishwasher. Getting your brain settled enough to initiate that task can be influenced. If it's a complex task, that's even worse. Like say, if we say, we have 4 different steps to do, there'll be a lot of procrastination. It'll be hard to initiate that task because it's hard to remember all of those. And so they just shut down. And there's also trouble prioritizing and organizing responsibilities. So that could be due to some of the impulsivity as well. It's really hard to organize your thoughts. And so organize what we're supposed to do, those responsibilities, and to prioritize them. I don't know, I'll just do whatever's easiest. Or one thing that happens a lot, and happens with me too, cleaning. So you start cleaning the kitchen, and then there's something on the counter, and you bring it to the bedroom. Oh yeah, I have to do this. You start cleaning the bedroom, and it's like, oh wait, I was cleaning the kitchen. You go back to the kitchen, and then you go to put something in the living room, or you see something in the living room. It's like, oh yeah, you start cleaning the living room. And then it's like, oh, I was doing laundry. And then you go back to do the laundry, and it keeps going. That's hard to prioritize and organize those tasks when your brain is doing that. And then impulsivity and self-control. So acting without thinking, interrupting conversations, blurting out. Sometimes risky behavior can be part of it. That's mostly males, but women can do that too. And difficulty resisting distractions, right? So you're doing something and there's something going on, and it's like, yeah, no, I'm gonna go look over here. Or, you know what, I'm preparing for my podcast, but wait, something just caught my eye, shiny. And so then it's like, nope, I'm going to go do that. And so you go and you do that. And then it's like, and I have to get back to do that. The DSM-5, so I have mentioned this before, it's the diagnostic manual that we have for mental health, it lists criteria. And the 5th edition, so we're now on DSM-5, it has categorized ADHD into 3 different categories. So it used to be ADHD and ADD, and now it's all ADHD, but there's ADHD predominantly inattentive presentation, ADHD predominantly hyperactive impulsive or impulsivity presentation, and then ADHD combined inattentive, hyperactive, impulsive presentation. And based on assessments and where a client meets different criteria, they're categorized into one of those. I'm often asked what causes ADHD. And like most mental health problems, I don't think there's any concrete, this is what does it. But some ideas around it, what research has shown, genetics can play a part. So there could be some neurological and genetic origins. So what that means is if somebody in your family has ADHD, there's a good chance other family members, if you have ADHD, there's a good chance that your children or other family members have ADHD as well. And there's brain differences too that can cause ADHD, although it's kind of a chicken and an egg kind of thing, because it's debatable whether, the ADHD causes the brain difference that I'm going to share in a second, or if the brain difference causes ADHD. That's still being debated. So there are structural differences in the brain with ADHD compared to those who don't have the condition. It was found that ADHD reduces the gray matter volumes and there's 4 different areas of the brain. I'm not going to share them because I don't need to say what the areas are. If you do want to know what they are, feel free to drop us a line, a DM or something, and we can answer them, but it doesn't really matter. I always say that I think when they were naming parts of the brain, they just threw a whole bunch of Scrabble letters on the table and whatever came up because, yeah, yeah. So the reduction in gray matter could explain why with the people with ADHD have attentional problems. Because gray matter is involved in learning and memory and cognitive processes. So, and attention. So if you are deficient in gray matter, then, but are you deficient in gray matter and that causes the ADHD? Or do you have ADHD and it depletes gray matter? They're still looking into those sorts of things. And also, it would also explain some of the differences in males and females because gray matter is different in males and females as well. There could be environmental factors. I don't know if these actually cause ADHD, but they can, they can increase the likelihood of someone having ADHD. And so exposure to lead or pesticides in early childhood, which would explain why so many Gen Xers, because we had lead-based paint in our crib. I'm joking. Well, no, I'm not joking. That's true. But that's a joke that we always say, right? Premature birth or low birth weight could cause ADHD. Brain injuries. So sometimes if it's a traumatic birth too, and the child, has some brain injuries, that could cause ADHD as well. Some of the factors that do not cause ADHD. And I kind of laughed when I heard this because I see it all the time, or when I read this because I hear it all the time, right? Watching excessive amounts of TV. That's not going to cause ADHD. And I just want to address that a little bit because there have been books, I've read books on how social media and just our phones, our computers, our devices that we have. I didn't grow up with devices. I think I was like 22 or something when we got internet. So I didn't grow up with any of that stuff. However, I have to put my phone on the counter or something at night because I might be watching a baseball game. And as I'm watching the baseball game, I'm on my phone scrolling mindlessly. And then I'm like, oh, he's on third. What? And then I'm rewinding. And then, and then I miss it again because I'm back on my phone. And that's not ADHD per se, right? A lot of us are very distracted. We live in an always on generation. We're always connected to devices. We can't just sit and do one thing. But I think that could that lead to ADHD? Maybe. I'm not a neuroscientist or anything like that. But I don't think I think that that's just this distractibility that we have now. And I think that's why a lot more people think they have ADHD as well. It's really hard for us to focus because we're always stimulated. Something else that does not cause ADHD, eating sugar, family stress, parenting styles, and traumatic experiences. They don't cause ADHD, but they can absolutely exacerbate the symptoms of ADHD. All right, so now I'm going to talk about symptomatology and how it differs between genders. And when I share this, you're going to see why so many females get brushed under the rug. Their symptoms of ADHD do, not them. So boys with ADHD tend to exhibit more externalizing behaviors. So that's, the hyperactivity and the impulsivity. There's a higher number of, more prevalent, being diagnosed with ADHD, hyperactive, impulsive, or combined. And they're more likely to show signs of disruptive behavior disorders. And it's a more overt, right? And so their diagnosis they're usually diagnosed earlier in life because they're disrupting the classroom, church, wherever they may be. It affects other people, and so it's more noticeable. And they're the ones that are usually referred for services or assessments. Girls, on the other hand, display more internalizing behaviors or internalizing symptoms, right? So that's why they're more overlooked. They're not a disruption to the classroom. I'm going to talk a little bit soon about, this, what society tells girls they should be like and why this, they internalize more, but they're not disruptive and they get their work done. And it might take them 4 times longer than a typical student, but they get it done. And so they get missed. They're quiet. They don't disrupt. And so these internalizing symptoms make it go undiagnosed. So girls are usually diagnosed with ADHD inattentive presentation, sometimes combined. So all the stuff I'm talking about doesn't mean, it's not a generalization, or it kind of is. It doesn't mean that every girl is only diagnosed with inattentive. No girls display any disruptive behaviors. I'm not saying that. I'm just saying typically speaking. So some of the symptoms that girls might display: difficulty sustaining attention, tendency to be easily distracted, frequent daydreaming, and problems with organization. And I know that a lot of clients, I see it. I see my clients that have ADHD, men too, but women, I see them. They're looking at me when I'm talking and they're nodding, but there's like nothing there. It's completely blank. And so I'll say, where are you right now? Right? Because I know, and they're like, oh, geez, sorry. And they're thinking about what they have to get at the grocery store after the session, or what happened at work, or, or it was sunny today, right? It's just their brain goes in different directions. So like I had said, female inattentiveness is less disruptive. And so because of that, they fall through the cracks. There's also age-related changes in ADHD. When we're shifting into adulthood, the presentation of ADHD can evolve. So men may carry childhood symptoms into adult life, but the hyperactivity often diminishes, okay? Not always, but it often diminishes. And challenges with time management, executive function skills become more apparent with men. Women may experience an exacerbation of ADHD as they get into adulthood because of all the hormonal changes. There's such a connection between ADHD and hormonal changes. So we're talking like puberty, menstruation, menopause, pregnancy. So their ADHD might emerge as anxiety and depression. It often presents as that. And those are conversations I've had with many, many female clients. And females who have not been diagnosed or underdiagnosed in childhood might recognize their ADHD symptoms in major life transitions, like pregnancy or right after childbirth. And we're going to talk a little bit about that coming up, about estrogen and progesterone and how that impacts ADHD because of the chemicals in the brain that it, like the happy chemicals that estrogen brings and progesterone kind of takes away. And let's talk ADHD in girls now. I've kind of given a general, this is what ADHD is, this is how it presents in men and women, but I'm going to share specific symptoms in men as well, but to look at the symptoms in women and girls. So they're less likely to be hyperactive, but it's an internal hyperactive. So they're less likely to be the stereotypical hyperactive. It's internal. And that internal hyperactivity presents as overthinking, negative self-talk, intrusive thoughts that just keep like that negative feedback loop, right? That spiral. And some other internalized symptoms of inattention, distractibility, and hyperactivity among girls and women are maladaptive daydreaming. Sometimes daydreaming is okay. right? We sit there and we think about things and we plan things, and that's daydreaming. When we might not be focused on task, but we are thinking about a goal that we have, or we're coming up with ideas and stuff like that. But maladaptive daydreaming, where we're just kind of zoned out, we're just like in la la land. Some other presentations: anxiety, depression, spacing out during conversations, like I had said, easily losing focus. So that's whether you're doing a task, having a conversation where you're like, I don't even know what I was talking about. I have no idea what I just said, right? Or what I was going to say. Auditory processing disorder, forgetfulness, eating disorders can come from ADHD. Hypersexuality. Think about impulsivity, right? Think about the dopamine levels that decrease. And if you think about hyperactive and impulsivity, boys is external, girls it's internal. Hypersexuality can be part of that because it's, not thinking about the consequences, not thinking about cause and effect, not thinking about outcomes, consequences, and just getting that dopamine rush when it's depleted. Impatience. So body-focused, repetitive behaviors. So that can be skin picking. That's actually a big one. Hair pulling. They just kind of pull hairs out. Or they do this a lot. Leg bouncing. That's a big one. And as I look over at my counterpart and she's bouncing her leg, and I've been doing it as well. But yeah, leg bouncing is huge. And I joke with my clients sometimes because we're talking about ADHD and I'm like, you mean like your leg right now? And they're like, oh, geez, right? Or this, we'll do this, right? Or I just see clients doing this a lot, playing with their rings, doing this with their fingers, that kind of thing. It's the fidgety. And fidgeting is actually a question on the adult ADHD assessment. Fatigue, insomnia, crying with deep emotion and anger and feelings of guilt and shame, and shyness due to social anxiety and sensory sensitivities. So if you think that your brain is on overdrive, sensory is going to be really overstimulating, and people with ADHD may have increased sensitivities to sensory. So there's also something called rejection sensitive dysphoria, RSD, that comes with ADHD. It's not on the DSM-5, so it's not a diagnosable, but it is a component of it. And with the RSD, so rejection sensitive dysphoria is if you ask someone with ADHD says, do you want to go for a walk? And the other person says, no, not really. That's rejection. And right away the brain goes into, oh, they don't like me. They don't want to be around me. And it can go into that spiral. And because of RSD, females present with perfectionism, people-pleasing, codependency, body dysmorphia or negative body image, low self-esteem, overachieving or underachieving, intense emotional reactions, and overwhelm. And as I said, it's not on the DSM-5. You won't find it as a diagnostic, but it is a part. And it's also a part for males too. I'm going to share how it comes out in males as well. Totally different than how it comes out in females. It's not the perfectionism. It's not the people pleasing, because females internalize. I'm going to keep repeating that because we don't get that, right? That is, most females internalize ADHD. They internalize a lot of feelings and behaviors. And so it comes out more in the things of them, right? How they can do better, how they can be perceived by others. So ADHD symptoms in men and boys. Again, they're more external behaviors. So the hyperactivity, yes, we may bounce our feet, we may fidget a bit. It's more the fidgeting as well with males. Disruptive behavior, frequently losing items, interrupting others during conversations, aggressive behaviors, and high-risk behaviors. So it could be substance misuse, speeding, unhealthy sexual behaviors, excessive financial spending. There's the impulsivity, right? And it's external. So how does RSD present in men and boys? Men and boys with RSD can experience low self-esteem, low self-worth, insecurities, but most of the time it's externalized, like anger, aggression, or apathy, self-centeredness. They might seem insensitive to other people's needs or other people's emotions, teasing others or being really sarcastic, needing to be right, or proving others wrong. You know, that they I call them right fighters, right? They just keep trying to prove that they're right, and then if they do prove they're right, they're like, yeah, right? And they're like kind of in your face. That's the impulsivity, that external behavior, and defensiveness. So the heightened emotion or the emotional dysregulation in males look more like temper tantrums or anger outbursts. Okay. There are many men that are emotionally sensitive, but because of the gender biases, they might fear or they might feel shame or fear of expressing it. And so they do internalize because society, you know, I felt it necessary to share this too because this is Men's Mental Health Awareness Month. But because of that, you know, those masculine norms, they have to be tough or strong. They have a hard time showing that. And if there's ADHD and there's already dysregulated emotions, it can increase the shame or come out as anger because anger comes out to protect us. All right, so those are the different symptoms that can present and the RSD symptoms. And now, because women just seem to keep getting hit, I'm going to share how hormones can impact ADHD. And, you know, I knew a lot of this stuff already. Obviously, this is what I do. But in doing the research and reading some of the things, I was like, what? The impact that it has. And one thing that I didn't know, remember I said I'm always learning, and doing this process is teaching me more too. I have some female clients who have been diagnosed with premenstrual dysphoric disorder, PMDD. And they are some of my clients who are we're trying to advocate to be diagnosed with ADHD. And I just learned that women with ADHD are more likely to experience PMDD. So there you go. So in one journal that I read, Journal of Psychiatric Research in 2021, they were examining the prevalence of hormone-related symptoms, hormone-related mood disorders, and so like PMDD, postpartum depression, and menopausal women or menopause. And they had three key findings with those three. So premenstrual dysphoric disorder, PMDD, like I said, they're more likely to experience severe PMDD symptoms. This can worsen the emotional and cognitive issues with ADHD in the premenstrual phase. Okay, so a lot of my clients too have been provided antidepressant medication when they're experiencing PMDD. And this journal, this research, this study in 2021 found that antidepressants were linked to more PMDD symptoms, and contraceptive use was associated with fewer symptoms, and a direct link to ADHD. More women have it. Postpartum depression. So postpartum depression, or PPD, affects like the general population, 14 to 19% of the general population. And what this study found was that there's a higher prevalence in women with ADHD of postpartum depression. And it can worsen the ADHD-related challenges, particularly, you know, managing emotional stress, maintaining routines, organizing, those types of things. And then the menopausal symptoms. Women with ADHD report increased anxiety with menopausal symptoms, increased anxiety, depression, somatic complaints. This study highlighted a need for more support during this this phase. And menopausal symptoms can worsen the forgetfulness and emotional sensitivities. That is a menopause symptom. But if you already have ADHD, well, then it's magnified. If we look at hormones for females throughout the lifespan, so I'm just going to relate them to ADHD. At birth, an infant girl has like high levels of estrogen and progesterone. They're quite high, and then they drop significantly a few months after. They're very low, but they're also very consistent. So it just kind of stays the same for little girls, for young girls. So for some young girls, their ADHD symptoms may start in early childhood. And because the hormone levels are consistent, they may display a lot of the same behaviors as boys. And so they may be easier to treat. Even if they're not the same symptoms as boys, they're still easier to treat because I'm going to share how hormone levels can actually affect the medication and metabolize it faster. So because their hormone levels are consistent, they can be treated more easily. And the treatment often looks like the same as the treatment for boys. And then the young girl grows and they enter puberty. So ADHD and puberty. When a female enters puberty, there's a rapid increase in estrogen and progesterone. And because they both rise so sharply, progesterone often negates estrogen's positive emotional and cognitive effects. Estrogen is a good thing, and it increases the happy chemicals. So the increase in progesterone can trigger a girl's amygdala, which I have shared previously, but I'll share again, just in case you haven't heard any of my other podcasts. The amygdala is the stress response center of the brain. It's within the stress response center of the brain. That's the emotional, that can get you highly emotional. Yeah, the emotional center of the brain. And so it primes that. It gets it going, progesterone. And because that happens, and it negates the estrogen, that can cause depression, anxiety, or increase depression, anxiety, irritability, impulsivity, which then makes ADHD harder to manage because some of like the impulsivity, irritability can be symptoms of ADHD. So when I say to clients, well, ADHD often presents as anxiety and depression. That's why, right? Those hormone influxes or the rush of hormones in puberty, that's, where it's not where it starts. It starts in childhood too. But usually before the age of 12 is when it starts. But it can really manifest as anxiety and depression because of the rush of hormones, estrogen and progesterone in puberty. If that makes sense. Just to add to that mess that's happening, the rising hormone levels in puberty for females often cause the female body to metabolize medications faster and or more quickly, so they're less effective. And unfortunately, because of the rising progesterone, increasing the dosage isn't going to make a difference. So for boys during puberty too, because they are growing, they may be metabolizing their medication as well. But for boys, they increase the medication and then it's good. For girls, nope. Right? So it's already leaving emotional and irritable girls without the same resources they once had. Because they're going through puberty, then we have, their menstrual cycles and ADHD and PMS. So as a girl grows and goes through her teen years, estrogen and progesterone levels continue to rise until they peak sometime in their 20s. But because of the menstrual cycle, they dramatically change throughout the month. So rising and falling. So with what I just told you about estrogen and progesterone and how progesterone negates some of the positive qualities that the estrogen is putting in, you can see how, it's rising and falling throughout the month. It makes it very difficult to manage ADHD symptoms. When they are rising and falling, the ADHD symptoms are changing as well. In the first 2 weeks of the menstrual cycle, peaking levels of estrogen will make a female's mood high and her ADHD symptoms more manageable because estrogen helps with dopamine, serotonin, and norepinephrine, the happy chemicals. But after ovulation, she's likely to notice her mood fall and her symptoms rise because the estrogen levels drop and then her progesterone levels rise. So once her period arrives, both estrogen and progesterone fall again, and then the cycle starts all over. So just to clarify and summarize, during the first 2 weeks, estrogen is rising and progesterone's lower. So their mood is better. They're able to manage symptoms. After ovulation, estrogen levels drop, progesterone levels rise, so mood goes down. There's more of an inability to manage ADHD symptoms because they go up. And then period arrives, estrogen and progesterone both fall, and then we start all over again. As this female is growing, they may find themselves pregnant. And so ADHD and pregnancy, again, a woman's hormones change during pregnancy. So in the first trimester, a woman's body sees rapid change, pretty intense rise in both estrogen and progesterone, which leads to tremendous increase in ADHD symptoms and increased fatigue, mood issues, and anxiety. Okay, so progesterone and estrogen are increasing rapidly, so the symptoms are increasing. ADHD symptoms are increasing as well. Just to make it worse, as the woman's ADHD symptoms are increasing, rapidly increasing, she's usually advised to go off her stimulant medication because she's pregnant and to protect the baby. So that's going to cause, really exacerbated symptoms. And it's going to go from feeling hard to manage the ADHD symptoms to almost unmanageable. I'm not trying to bring people down and catastrophize, but these are things that are happening. And I think that it's really important for us to know about them because most people don't. They don't know. They're not educated in the connection between estrogen and progesterone and ADHD. And we need to be. That's another reason why it goes undiagnosed. And even without that component, that's what women go through, right? We go through so much. We go through so much, but that is what they're going through. I guess that's what makes us so strong, right? So nature does come in with an assist during pregnancy. And the second and third trimester is when a woman will often get relief. So she'll get high and steady levels of estrogen. And so they will relieve some of the symptoms. They'll ease the symptoms and her mood. So there's a positive in that. After childbirth, however, estrogen and progesterone decrease again. They drop dramatically. And so that can create deep depression, struggles with anxiety, and renewed struggle with ADHD symptoms. Postpartum depression. There's the connection. Also, there's another reason why, there's the connection why women with ADHD experience postpartum depression more as well. And then we're done having babies and we go into perimenopause. Sometimes in her 40s, a woman will go into perimenopause. They enter perimenopause. Sometimes I know some women in their 30s, late 30s, and some women not till their 50s. So During this time, which can be like a decade long, a woman's estrogen and progesterone levels become erratic, and they drop almost 65%. It can cause a drop in serotonin, dopamine, and norepinephrine, which I have said are the happy chemicals. And that can cause sadness, irritability, fatigue, that brain fog, that fuzzy thinking, memory lapses, and struggles with inattention. And that's for a typical woman, right? That's not mentioning the ADHD symptoms that would be exacerbated by all of that. So yeah, like I said, that's hard for any woman to go through. And for women with ADHD, given the struggle she already has to deal with the brain fog and the short-term memory and concentration issues, cognitive processing, it's really exacerbated during this time. So once a woman goes a full year without a period, they hit menopause and then postmenopause. With the woman's last period, so 12 months since her last, estrogen levels drop dramatically, which in turn can cause a drastic decrease in the release of serotonin, dopamine, and norepinephrine. That is going to cause ADHD symptoms, especially mood symptoms related to it, to spike, to escalate. The good news, I'm a glass half full kind of gal. The good news is the progesterone also decreases rapidly and drastically down to 0. And so that allows any estrogen that is there to do its job. So the other good news with menopause is that hormones stop cycling. So you're not going to have the increase, decrease. There's always decrease, right? And so treatment for ADHD does get easier. It's easier to manage the symptoms with medication. The symptoms are more consistent once you hit menopause, postmenopause. So now that I've really uplifted all women out there, I don't think it's anything, how we go through all of these hormonal changes in our life, I don't think that's shocking. But I don't think a lot of people understand, like I'd said earlier, the connection with the hormones and what's actually going on in our bodies. Now I want to talk about the diagnostic gap. Why are so many males being treated, referred, diagnosed, and females aren't? I read an article, it's a really good one, by the Center for ADHD Awareness Canada, and they did a survey. And in that survey, Canadian women with ADHD found that, the survey was of Canadian women with ADHD, and 46% were misdiagnosed with another disorder before they were diagnosed with ADHD. And further, you ready for this one? 60% of these women felt that their treatment had been delayed by 2 decades or more due to the misdiagnosis. So many of the women in this survey spoke about being diagnosed and unsuccessfully treated for anxiety and depression. I hear this all the time. They're given anti-anxiety medications, they're given antidepressant medications, and they don't actually have anxiety and depression. They have ADHD. It looks like anxiety and depression. And it's not to say that it's not going to help mood a bit, these medications, but because they're given these medications and not treated for ADHD, it was misdiagnosed. They were treated for anxiety or depression for years, even decades, until underlying ADHD had been diagnosed. Then they're given the medication, and then they start to see a difference. And that is what I've seen with my clients that I'd spoke about previously in their mid-30s, that once they received the medication, it was like night and day. So what factors contribute to these gaps, the gender disparities in diagnosis? Stereotypical presentation is number one. this classic image that we have of what ADHD should be. It's a disorder for hyperactive boys, and that's led to a lack of recognition or a bias in recognition and a bias in referral too, because girls don't look like that, so they mustn't have it. Symptom expression is another reason why there's this gap, this disparity. As I've said a few times, girls don't exhibit the hyperactivity the way that boys do. They exhibit less overt hyperactivity. They internalize it. They show more inattentive symptoms that they can mask. They're less disruptive in classroom settings, so they don't get recognized or referred. And the compensatory strategies. So many girls with ADHD develop coping mechanisms that mask their symptoms. They develop their own strategies. So that it's harder to it makes it harder to recognize, for others to recognize the struggles. And I mean, these are coping strategies that they create, and that's great. And it's through necessity, it's through brain development, it's through that internalizing behavior, but that masking also makes it more difficult for them to be referred or for their symptoms to be recognized. And then comorbid conditions. So, as I had said, women with ADHD are more likely to experience comorbid anxiety, depression, personality disorders, eating disorders, other mental health issues. So those seem to overshadow the ADHD symptoms. Another reason why girls are less likely to be assessed for ADHD is because of the strong need to fit in, not be seen as different, and to be seen as competent. There's the masking. Boys in general seem to be less concerned with that, fitting in. And I'm not saying the boys don't want to fit in either. I'm just saying that, especially those with ADHD, girls want to fit in more. They want to appear competent. You know, the way society is, we still expect girls to be compliant, to be cooperative, sensitive to the needs of others, good students. And girls with ADHD are known to spend copious hours doing their homework, which is why they don't show poor marks on a report card, that they're being turned away from diagnosis because they don't have that, along with the externalized behaviors that they don't have, and they're being turned away because the report card doesn't show behavioral issues. But they spend hours on homework and assignments. That hides the academic struggles. And unfortunately, because of that, the more subtle ADHD symptoms in girls go, unseen, but there's also that need to conform as well. And because of those, that results in girls going unnoticed, or girls' ADHD symptoms going unnoticed, unrecognized, unreferred, or referred less for assessments and treatment. So not diagnosed, not treated, not understood, and not supported. So I had mentioned, the coexisting disorders, and that's another significant factor that interferes with the diagnosis of girls and women with ADHD, because they tend to internalize their symptoms and impairments. It's not surprising that they have comorbid. It's not surprising that this internalizing nature brings out anxiety. If they're putting hours into homework just to get things done, they're trying to focus and they're having difficulty doing it, but they need to comply and they need to look, like good little girls, and they need to do all this. That is exhausting, and that is going to increase symptoms of anxiety and depression. So as a female grows, this added stress that they experience with the hormonal changes and the internalizing behaviors, you are going to see more symptoms of anxiety and depression through the teen years and and as they get older. And because of that, Anxiety and depression is often diagnosed as their primary disorder, not ADHD. Once a girl or female, this is a big sticking point with me. Once a female is recognized as needing to be assessed, the assessments are all the old assessments. The assessments are based on stereotypical ADHD behaviors that we see in boys. The studies that the assessments were created from normed studies with male participants back in the day, right? They're still a lot of the same. I've noticed some changes in some, but no, it's still the same. And I'm going to share a story of somebody that I know and that went through the process, and that just it shows this. Many of the symptoms in the DSM-5 are the stereotypical symptoms for diagnosing. They don't share the female presentation of it. And so a psychologist is going, or whomever is diagnosing, is going through the criteria manual and asking the questions. And no, they don't have that. They don't have that. They don't have that. Because that's not how it presents in females. And the other thing, and I am not speaking badly of physicians or psychologists or anything like that. What I'm saying is these are what they're given. And physicians aren't often trained in, and a lot of psychologists aren't often trained in the differences because we've been going with the norms, right? They're not often trained in those subtleties, the internalizing behaviors, the differences. A lot of physicians and mental health workers need to be trained in the differences. So when they're being trained in mood disorders, it's ADHD. And this is what it looks like. Not ADHD. And this is what it looks like in males. And this is what it looks like in females. There's no difference in the assessments or the training for it. And because when they're interviewing the female, the symptoms that they talk about more is anxiety and depression symptoms that are coming out. That's what they're diagnosed with. And the other is, what I've been saying is that they get the assessments done. They think that, these are all the symptoms. But it's more anxiety and depression, I think. Let's try the medication for that. Let's look at that first, and then we'll go to ADHD if we have to. Let's look at regulating your your hormones if you're in your 40s first, and then we'll look at ADHD, which, okay, valid, right? Because I talked about how hormones fluctuating can cause it, but let's look at the ADHD too in females. Another one that is also huge, and how I spoke about how, the effort that females put into conforming to societal norms and, being the good student and being the good mom and being the good wife or partner and, so on, that the energy that it takes, that's not taken into consideration. They're not saying, how much effort do you put into this, right? It's how much more effort do you put into, how much time does it take you to do this homework, this assignment, when the typical child or student, because it doesn't have to be a small child, but is taking an hour and you're taking 4. They don't ask those questions. They say, oh, no, those are the marks. That's good. Oh, no, you didn't misbehave in class. Nope, you're good, right? I know I keep repeating myself with that, but it's huge. And it is so hard for females that go through this. I get the other part of it. Obviously, I work with them with their ADHD, but I also get the side where they're in my office in tears because they are so frustrated or they are so exhausted and nobody's asking the right questions, or they feel like they're not being heard. All right. So I have spoken a little bit about the impact of the, of undiagnosed ADHD, but I want to expand on it a little bit more. Many women, I mentioned masking, but many women with ADHD develop masking and compensating behaviors to hide their struggles. So, like I said, they may work extra hard to appear organized. They may have an elaborate system to keep track of tasks, or rely heavily on others for support. I have so many clients, women with ADHD that have, these like Google Docs and all of these things that are keeping them managed. And that is a strategy that I do teach. Have a dish right at the door for your keys so that they're in the same spot. If you are cooking, when you're finished with one thing, put it away. Don't leave it out. Really stay on top of things, but that can be exhausting too. Having to make sure they have checklists and task lists and reminders, multiple reminders, so that they don't look incompetent. It can be really effective to have all of these strategies, absolutely. But because they have spent a lifetime masking and overcompensating, they may not even realize that they have ADHD. And so that attributes to difficulties of their perceived failings rather than it being a neurological condition. They think that they're just not enough, they're failing. Another impact of untreated ADHD on female adults is the profound difficulties in academic and professional settings. Women with undiagnosed ADHD may struggle with time management, deadlines, keeping on track with the project, organizing the project. It may take them much longer to complete projects, which is, the deadlines, meeting deadlines, and that can cause issues with other people, maintaining a job, staying in school. It can also lead to underachievement, missed opportunities, and this sense of chronic overwhelm. It's like, I can't get anything done. I just can't seem to succeed at anything. And because of this constant effort that they're putting in, it can lead to overwhelm and burnout, causing them to quit school, maybe, leaves from work, have to reduce their duties, which then again leads to feelings of failure. And we, as females, internalize those behaviors. So that's going to exacerbate the ADHD symptoms again. Another issue that arises with undiagnosed ADHD is relationship difficulties, social challenges, especially that impulsivity part. If you're, so afraid to blurt out, this is why a lot of women with ADHD present as social anxiety too, because they don't want to get out of their seat. They don't want to blurt things out, so they stay quiet. Sometimes their inattention might be misinterpreted as they just don't care. They're not interested in something. That can lead to strained relationships with partners, friends, family. It's like they're not paying attention. They're not listening. Clients have told me that they're often told, "Mom, you don't listen." They're trying to listen. They can't attend. That can cause a lot of problems. And the impulsivity and the emotional dysregulation can further complicate these social interactions, these relationships, and it can make it really difficult to maintain long-term relationships. Mental health issues and low self-esteem is another thing that is really prevalent with women who have been undiagnosed with ADHD. Years of struggling to try to understand why, like what is wrong with me? What is going on? Why can't I do any of these things? Can lead to feelings of inadequacy, shame, being a failure, self-doubt, and again, with anxiety and depression often co-occurring with it, being comorbid with it, it can exacerbate these challenges that we're talking about, and then further impact the quality of life. If we can understand the symptoms, if we can recognize them, if we can advocate for ourselves, the treatment involved, which yes, is usually medication and counseling, psychotherapy can help, or strategies, coping strategies with it. If we can do that, it's the quality of life, and I have seen it, it's like night and day. The change is fascinating. Another thing is women with untreated ADHD often turn to substance use. Males too. I've had a lot of, when I worked in the education system and here, a lot of people with undiagnosed ADHD do turn to cannabis and that type of thing, or alcohol, other substances. because it slows down the brain a little bit or gives that stimulant energy, right? But those are maladaptive ways of coping, and traditional medication for that is more controlled and a better way to manage those symptoms. And when our brain needs to be stimulated with ADHD, when it's like always on the go, we seek the stimulation, and the impulsivity associated with ADHD can lead to risky sexual behaviors, financial problems, or dangerous driving habits. People don't think of that, do they? All right, so how are we going to support and empower women with ADHD? What are some strategies? I actually have some for men and women here because I also want to show how they're different too, right? It's still ADHD, but how we can support them differently because of how they present differently. And if we can tailor the strategies specific to the genders, that's essential for effective management. Medication is beneficial, absolutely, for both genders, but the approach that we do, the strategies, it's not just about medicating, we also have to learn how to manage, right? So for women, cognitive behavior therapy, CBT, focused on self-esteem and coping strategies. That is, looking at the thoughts, the feelings, the behaviors associated with it, and what is causing the self-esteem. And let's develop some coping strategies. So some, like I had said about, like the actual ADHD coping strategies and techniques they can use, but also coping strategies for these internalized behaviors. We also need to look at hormonal considerations in medication management. If you are prescribing to a young girl going through puberty in teenage years and it's like, it's not working, increasing the medication isn't going to make a difference at that point because of what I had said about the hormonal changes. Support groups specifically for women with ADHD. Fun fact, it is on my list to offer at Dalgety Counseling and Psychotherapy is a support group for women with ADHD. We also want to offer one to men, but I think that, I'm not excluding men here because men with ADHD absolutely go through their own struggles. It's just that it's so unrecognized with women. And I want women to be able to get together and talk. That we may do an online one and an in-person one or combine them. But, get together and talk and support one another and understand that they're not alone in this, that this is a thing. It's not just their mind playing tricks on them, that it's not just about them, I should be better at. It is an actual thing. And like other women, they've probably been, slipping through the cracks for decades. And some coaching or some training on time management and organizational skills will also help. For men, the therapy part should be behavioral interventions targeting impulsivity and hyperactivity, and anger management and social skills training. So again, we're seeing the treatment is internal for women, external for men. Career counseling, academic support, and strategies for channeling physical energy productively. So, external. It is so important not just to have individual treatment for men and women, individualized in the sense that like gender specific for the different symptoms, but also individualized for that person. Everybody's unique. Just because women internalize, men externalize, it doesn't mean that every woman internalizes the exact same. It doesn't mean that every man externalizes the exact same. So it's really important for each person's experience to be brought into the therapy and the treatment. Each person's experience with ADHD is unique. We need to drive that home. As I've said, all of the assessments, all of the education is a one-stop shop for ADHD. It's not. It's gender specific. I can never say specific. It's gender specific and it is individual because it's all unique to that person. They need to be tailored to the person, to specific symptoms, to specific challenges and goals. There is also a need to update diagnostic criteria that include female-specific symptoms. We need these updates, both in the DSM and in assessments. It would involve, incorporating more inattentive symptoms and recognizing that ADHD in women will present differently throughout their lifespan. How they present at 8 years old with ADHD is going to be significantly different at 12 years old and significantly different, in 20s and so on, right? We've talked about all the hormonal changes in the lifespan. We need to educate healthcare providers on gender differences in ADHD. In med school, getting your PhD, getting your master's, that needs to be a part of the curriculum. That needs to change. We need to educate. We need to have more professional development for healthcare providers on the gender differences. Recognizing the subtle signs of ADHD in women, understanding how comorbid disorders or conditions may mask ADHD symptoms, digging a little deeper when it's anxiety and depression, being aware of the unique challenges faced by women with ADHD. And I wanted to share this because it goes right in with my drive to educate and advocate. And the CADDAC, so I'd said the Center for ADHD Assessment, the Canadian Center for, ADHD Assessment, they have two categories. They are asking that the Canadian government, and this would be any government too, increase awareness of ADHD in females through mental health and community health initiatives for the public, educators, and medical professionals. They're asking the government to fund the development and distribution of female-specific ADHD screening tools to all medical, educational, employment, and justice system professionals, and to encourage the development of normed rating scales for female ADHD and additional research into the vulnerabilities for females with ADHD through different funding opportunities. And then they're also asking the medical community to encourage all general practitioners and mental health providers to screen for female ADHD whenever any comorbid condition is being considered. It's just some more screeners, right? Let's dig deeper. Provide training for medical professionals on female ADHD assessments, diagnosis, and treatment, and the need for screening of suicidal ideation and treatment. And they want to encourage research into the added vulnerabilities for females with ADHD, normed rating scales for females with coexisting mental health disorders drastically interfere with the diagnosis of ADHD in women, how the hormonal fluctuations impact women with ADHD, and the best way to disseminate the research to all medical professionals. Let's attack it, okay? Before I go into questions, I just want to share a story about that person that I know. It's a client that I have, and she knows that I share her story. She has given me permission. I will not give any identifying information, but she knows I use her as an example because it's amazing. So I had seen her for a while. She was diagnosed with anxiety, social anxiety, and some depression as well. And, we did all of the strategies, and she was rocking the cognitive behavior therapy, and she was working so hard at it. And, this went on for her struggles with it for a few years. I didn't see her throughout those few years, but she reached out to me a couple of times in the last couple of years where she was really struggling, and we worked through different anxiety because different things going on. And we talked about ADHD a little bit. I saw some things. And so she went for ADHD assessments. And even though some of the assessments she scored higher in, they used her report cards from when she was a child. And those report cards stated that She did not have any behavior issues, and she had good marks. So they said that they would not diagnose her with ADHD. And she set up an appointment with me because she needed to unpack some of that. And she was distraught. She was so defeated. And I said, okay, nope. And I told her about my experience. And I said to her, I would go in my previous position, I would go to observe a little boy. And he would be bouncing off the walls, and he'd be jumping from seat to seat, and he'd be going around his desk, and he'd go and he'd knock stuff off other kids' desks, and he would be blurting out, and the teacher would be saying multiple times, please raise your hand. And as I'm observing this little boy, I'm looking over at this little girl who's staring out the window or turning her head and staring at the teacher. And I can see there is nothing there. She is like, she's in her own little world. She is not attending or concentrating on what's going on. And then I watch that little boy have no idea what he's supposed to do, and the teacher tells him to do it. And the teacher comes over, and again, no fault of the teachers because they're not educated in this either. But the teacher comes over and takes the time to show him again because she knows he has ADHD or has all the symptoms of it, stereotypical symptoms. And she goes over it again with him. And then the little girl goes up to her and says, I'm not sure what I'm supposed to do. And she's told to sit down and do her work because she was looking like she was listening. The teacher might give her a few things, but it's like, no, I just went over it, And there's the panic that I'd mentioned earlier. And so I shared this with my client. I said, go to your doctor, explain what I've told you. Tell her she can talk to me. Try the medication. If you have ADHD, there's going to be a difference. So I said, you have to advocate for yourself. You have to tell this story. Say how it's different. She went to her doctor. She was put on medication. And I saw her 3 weeks later. And I am not lying. Her coloring was different. She looked like a completely different person. She was happy. She said she hadn't felt that good in years. Her anxiety was lower. She wasn't feeling like a terrible mom. She felt more organized. She didn't feel depressed. She was telling her friends about it. She was living her best life is how she put it, right? Because she pushed and she advocated. And then she got, the medication. But why should she have to go through all of that? We need to change the stuff, right? And so I share that story, which actually answered the question that I had, which was I've had assessments done for ADHD. And because my report cards when I was a child didn't indicate behavior issues and bad marks, they would not diagnose me. What should I do? And I just shared it, but advocate, show statistics. If you have a mental health provider, get them to write a letter of your symptoms. Demand the assessor to look at different things. We will continue to be swept under the rug if we don't make this prevalent. So let's do that, okay? Seek the support that you need. We need to gain a voice, and we need to really make these changes. Be the change you want to see in the world, right? It can be impacted. It can impact this as well. So do not just settle when they say, no, sir, you don't have ADHD because of this. Don't stop. Advocate. Keep pushing. That is my best advice for that. And also seek support for strategies to help manage as you're doing this. Sometimes it can take a while. I don't want people to keep pushing and not have the coping skills for it in the meantime. So I just had one question today, and that was it. All right. So really look at the changes or the differences in men and women, male and female presentation of ADHD. Men externalize, females internalize. They do not present the same. Recognize those. Understand that assessments don't always show the differences. When you're doing the assessments, when you're getting the feedback, ask questions. And I really want, as I've said all along, I always say knowledge is power. And so understanding hormonal fluctuations and changes can really help, especially the women that I have in their 40s that are like, what is going on right now in perimenopause? So just in general, but then with ADHD. So let's educate ourselves. I hope that today's episode has helped do that. I know that even though I do this all the time, like I said, I learned a lot doing the research on this too. Things that I had an idea of, like the hormonal changes, I didn't know that much about them. So let's educate. And I hope that I did that. All right. I will see you next week and take care of you.